Hey everyone, and welcome to today's Explainer. We're diving straight into what's being called the breaking point. We're looking at a massive, literally catastrophic breakdown of how we traditionally handle epidemics, and it's unfolding right this very second. But don't worry, it's not all doom and gloom. We're also going to explore an incredible tech-driven solution that could seriously change the game for how humanity survives future outbreaks. So, it all starts with this pretty chilling question, and it perfectly captures the reality right now in the Democratic Republic of Congo. What actually happens when an epidemic just totally outpaces the cure? Because based on what we're seeing, the Ebola outbreak in the DRC is moving way, way faster than anyone can contain it. And we're not just fighting a virus here. We're dealing with a massive crisis of trust, absolute fear, and infrastructure that's basically failing. The situation on the ground is honestly terrifying. DW News reported on just how badly this epidemic is outpacing containment. It got so desperate at Mungbawalu Hospital, that's near the Uganda border, that locals actually attacked the facility and burned down Doctors Without Borders tents. The bodies of Ebola victims are incredibly infectious, but out of sheer panic, young men were demanding the bodies of their relatives be handed over. It's just sheer panic boiling over into violence, which of course only slows down the medical response and completely shatters those crucial transmission protocols. So why exactly is this traditional top-down containment completely collapsing? Well, Christian Katze from Doctors Without Borders points out three main reasons. First, massive diagnostic delays. They have to send samples all the way to a central lab in Kinshasa. Second, the local clinics are severely under-equipped. And third, and this is a big one, there is a deep, deep mistrust of central authorities. People just simply don't believe the information the government is giving them. When you add the human element into that mix, you've got a total disaster. The Danish Refugee Council highlighted that this area is hosting hundreds of thousands of displaced, completely terrified people. We're talking about places without basic infrastructure, no running water, no latrines. It is literally the textbook definition of a perfect storm for a virus to just take hold and spread like wildfire. And honestly, it all boils down to human psychology. People are afraid, and when they're afraid, they do lots of things that are irrational. Because of this intense fear, families are denying they're even sick, and they're hiding infected relatives at home, and that practically guarantees the virus is going to spread through the entire family. It's pretty clear that the World Health Organization's traditional approach, forced quarantine and centralized testing, is just failing here. We desperately need a massive paradigm shift. Instead of forcing isolation from the top down and hoping people comply, what if we actually empowered communities to self-isolate from the bottom up? And that brings us to the Dr. Maya solution, shifting the paradigm. Okay, so the physical core of this solution is something called the Prima kiosk, and it's supported by mobile apps. It was designed by Dr. Karyali Srivatsa, and it truly is a beacon of hope for humanity right now. This is a solar-powered, offline-capable terminal that sits right in the middle of a village. It uses Dr. Maya AI to recognize symptom patterns, and it does it in local languages, which is absolutely huge for populations that are completely cut off from digital healthcare. Now, this isn't just a charity drop-off. It's built on some really brilliant behavioral economics. Locals, like street vendors or mothers, can actually be trained as Maya advocates. They get paid to operate these kiosks, so it turns public health into a grassroots business. And trust is built almost instantly because, think about it, the medical guidance is coming from your neighbor, not some distant government official. The whole system relies on this beautiful simplicity. Dr. Maya uses something called the CALM framework, Cognitive AI Life-Saving Management. It basically takes complex medical triage and turns it into a simple, color-coded system that anyone can digest, even if they can't read. Red means it's an emergency. Blue, which is super critical during outbreaks, means possible infection, isolate immediately. And then yellow and green mean mild to moderate issues that you can manage with self-care or maybe just a chat with a pharmacist or a nurse. So the whole user experience replaces all that panic with clear, structured action in just 4 steps. You walk up to the kiosk or open the app, speak your symptoms in your own language, the AI recognizes the pattern, and boom, you get your color-coded guidance. What's absolutely crucial here is that interacting with Dr. Maya actually helps people learn about the infection in a language they understand. It intercepts them right then and there before they hop on a crowded bus or go sit in a packed hospital waiting room. And why is keeping infected people out of waiting rooms such a big deal? Well, 50%. That's the terrifying mortality rate we saw for healthcare workers during the West Africa Ebola epidemic. So getting people to isolate early at home, hitting that blue code, is absolutely mandatory if we want our doctors, nurses, and the whole healthcare system to actually survive an outbreak. Which brings us to our next section, a blueprint for the post-antibiotic era. You see, this local empowerment model isn't just for Ebola. It scales up into this massive defense network against our next great global threat. We're talking about antimicrobial resistance, or AMR. It's a silent killer that is already claiming over 1 million direct lives every single year. Dr. Srivatsa is warning us that we are rapidly heading toward an era where our antibiotics are simply going to stop working, mostly because the overuse of broad-spectrum antibiotics is just accelerating this whole crisis. And that brings us to a really sobering reality. When you don't have a cure, containment is the only survival strategy. If these bacteria outpace our drugs, then keeping people separated during those very first stages of infection is literally humanity's primary and maybe only shield. Dr. Maya's system flips the script to focus on managing the flow of the infection rather than just crossing our fingers and relying on a cure. And beyond just helping individuals figure out what to do, these connected kiosks and apps do something incredible. They create a real-time, anonymized surveillance net. Every single symptom entered feeds into a system that can flag unusual clusters days before they turn into a regional catastrophe. It's kind of like catching the spark before the whole forest catches fire. It gives health authorities the actual power to act way earlier and a whole lot smarter. So, the sources we're looking at outline a very clear call to action here. Global health authorities, and specifically organizations like the WHO and the CDC, they really need to implement this system. They've got to acknowledge the limits of that centralized lab testing, adopt this grassroots AI triage, and truly empower communities to self-isolate. That is how you prevent the spread and contain these infections as soon as possible. I'm going to leave you with this final thought today, and it's a pretty profound one. The tool to empower humanity, reduce our dependency on these failing antibiotics, and actually stop the next outbreak, it already exists. Dr. Maya AI and the whole Prima ecosystem offer a totally patient-centered beacon of hope. But the big question remains, will global health authorities just sit around and wait for the next pandemic to strike? Or will they have the courage to implement the early warning system we already have today? Thanks so much for joining me for this explainer. Keep learning, stay curious, and I'll catch you in the next one.